Hi, I'm Dr. John Johnson. Thank you for watching our informational video about chronic pain. Chronic pain is a condition that many Americans suffer with regularly. For this video, we will be offering alternative therapies to dealing with chronic pain for those that don't have access to traditional therapies. This is Jamie, and Jamie will be representing chronic pain throughout this video. Don't worry, no Jamies were harmed in the making of this film.
Hey, I'm Turmeric. If you can't get access to standard therapies, don't worry. You can find a powerful pain reliever right in your spice rack. Turmeric is a spice derived from the turmeric plant. It is used most often to flavor or color foods such as curry, mustard, butter, and cheese. Studies have shown that it can decrease swelling and inflammation, but don't take all the turmeric from your granny's spice rack. Turmeric studies show that this vibrant spice is most effective at relieving pain from osteoarthritis.
Love it from the bottom of my heart. Thank you, thank you, thank you.
I know you might be thinking it's magic, but there's always a little good with the bad. Turmeric can cause mild GI, such as nausea and diarrhea. And if you're pregnant, you might want to talk to your doctor before you start turmeric because it can promote menstrual bleeding. It can also worsen symptoms of gallbladder disease, and it increases the anticoagulant effect of aspirin. It can also decrease blood sugar, so diabetics should be careful. If turmeric can't do the trick, white willow bark sure can. White willow bark from the white willow tree has been used for centuries to relieve pain and reduce fever. During the time of Hippocrates, he would advise his patients to chew the bark of the willow tree because it contains salicylic acid, a precursor to aspirin. It exhibits similar properties to aspirin. White willow bark can relieve chronic pain associated with arthritis, back and neck pain, and muscle aches. Specifically, patients with arthritis have experienced decreased swelling and inflammation and improvement in mobility when taken long term. The best part is that this alternative doesn't cause GI upset in usual doses. However, if you're allergic to aspirin, you may also be allergic to white willow bark. Patients taking white willow bark should avoid taking it with aspirin or while pregnant or breastfeeding. Some studies have shown white willow bark to increase the risk of Reye syndrome in children with a viral infection.
When you've got a date with chronic pain, you need a lot of tools at your disposal, especially if you can't get access to regular pain-relieving therapy, such as traditional opioids or NSAIDs. One very effective but controversial therapy for pain relief is the plant Mitragyna speciosa, colloquially known as kratom. Kratom is related to the coffee plant and comes from countries of Malaysia and Indonesia. The plant is abundant and grows freely in the jungles of these areas, at times growing into trees as tall as 100 feet. For centuries, the people of these regions used kratom to combat pain from hard farm labor and to provide relief from opioid addiction. Kratom is consumed in many ways. Traditionally, the people of the East would chew the leaves of the plant plucked straight from the tree. However, as it's gained popularity in the West, it is most often consumed as a tea, where the leaves are dried and ground into a powder and mixed with boiling water. The current science on kratom is limited, but from what is understood, it is believed that kratom contains two alkaloids that act on the mu-opioid receptor, similar to traditional opioid medications. However, it has been observed that kratom's action on this pathway does not recruit beta-arrestin, which is responsible for traditional opioids' lethal effect of respiratory depression. Anecdotal evidence shows that kratom has a similar strength of analgesic effect as oxycodone, but without many of the side effects. Many users report mental clarity and stimulation rather than sedation and drowsiness that is common with opioid medications. Of course, there are some undesired effects of using kratom for relieving pain. Kratom is known to cause nausea, vomiting, and constipation. Those with a genetic risk for hepatic disease are at a higher risk for developing hepatotoxicity when taking kratom. Chronic use of kratom has shown mild dependence developing. Severity of dependence is dose-dependent but often presents similarly to coffee or caffeine dependence and withdrawal symptoms. Those taking kratom should not drive or operate heavy machinery until it is determined how kratom affects you. Kratom is very loosely regulated, and as such, some products have been found to be adulterated and contain dangerous synthetic opioid analogs. It is very important that if one does purchase products, to only use products that are endorsed by the American Kratom Association's good manufacturing processes.
Have you ever thought that your pain might be the result of a deficiency?
What?
Vitamin C is an integral vitamin in regards to pain relief. Vitamin C is an essential element for the health of collagen, the main ingredient of ligaments, tendons, and bones. A deficiency of vitamin C could mean a deficiency in collagen, and thus lead to chronic musculoskeletal pain. A number of recent clinical studies have shown that vitamin C administration to patients with chronic regional pain syndrome decreases their symptoms. Vitamin C have also shown a lower required dose of opioid medications for desired analgesic effect. Vitamin C supplementation does not show many negative side effects, but many lifestyle choices can affect the amount of vitamin C a person has regardless of diet. Smoking, caffeine intake, and alcohol consumption can drastically reduce vitamin C levels. Before trying other pain-relieving therapies, always be sure your vitamin C is where it needs to be.
Hi, Dr. John Johnson here, and thank you for sticking around to see the important points to ponder for providers and nursing staff. Chronic pain important points. According to a CDC study in 2016, an estimated 20.4% of U.S. adults had chronic pain. Some of the top risk factors for chronic pain are having a chronic condition, depression, smoking, obesity, and being of the female sex. Chronic pain is a very expensive condition. The total cost for chronic pain in the United States ranged from $560 to $635 billion. Important points to ponder for turmeric. Turmeric is a yellow-colored powder ground from the root of the turmeric plant. The mechanism of action is turmeric contains an alkaloid called curcumin, which blocks inflammatory cytokines and enzymes, including cycloogenase 2. The indications for use are seen in chronic pain, osteoarthritis, and mild acute pain. Some of the advantages and benefits of turmeric are that it is a pain reliever, and that studies seem to support turmeric for pain relief, with one study noting that it seemed to work as well as ibuprofen or brand name Advil in people with arthritis in their knees. Some of the disadvantages and risks to turmeric use are its taste, which is very spicy and bitter, an upset stomach, risk of developing kidney stones, nausea, diarrhea, and iron deficiency. The contraindications for turmeric being hypersensitivity to turmeric, bile duct obstruction, gastric ulcer, and it may cause bleeding prior to surgery. Some indications for other pharmacological therapies. Data suggests that the diclofenac-curcumin combination can interact at a systematic level and may have therapeutic advantages for clinical treatment of inflammatory pain. Some of the interactions for turmeric are their ability to potentiate the effects of anticoagulants, platelet inhibitors, and thrombolytic agents. This all could possibly increase the risk of bleeding, so users of turmeric should be careful of combining it with other drugs. Important points to ponder for white willow bark. White willow bark is the bark from several varieties of willow tree. The main mechanism of action being that the active ingredient, salicin, inhibits COX-2 enzymes. Indications for use are often seen in inflammation and lower back pain. Some of the advantages and benefits are that it's easily acquired and it appears to have a longer analgesic effect than aspirin. Some disadvantages and risks are that there is insufficient scientific evidence to tout the effectiveness of white willow bark for analgesia. Contraindications: children under the age of 16, people with asthma, diabetes, gout, gastritis, hemophilia, stomach ulcers, or those with kidney or liver issues, and anyone with an allergy to aspirin. There were no implications for use of other pharmacological therapies when referencing white willow bark, as each drug that it was combined with would just seem to increase the adverse effects. Some interactions that white willow bark has with drugs are anticoagulants, NSAIDs, salicylic acid derivatives. Some important points to ponder for kratom. Kratom are the leaves of the plant Mitragyna speciosa. The main mechanism of action is that it contains mitragynine, which is identified as a partial mu-opioid receptor agonist. The indications for the use of kratom are chronic pain, diarrhea, opiate withdrawal, and insomnia. Some of the advantages and benefits of kratom are that it's easy to obtain, cheap, has an easy route of administration, and desirable side effects, such as mood boost, energy attenuation, and focus. Disadvantages and risks for kratom are that there is little regulation, which leads to a higher incidence of contaminated products. There's also little scientific study done to back the effectiveness of kratom. It has a bad taste when consumed as a beverage, and there is a light potential for abuse and dependence. And it has history of creating liver toxicity with those that chronically use it. Some contraindications for kratom are pregnancy or breastfeeding, if someone is on an MAOI or SSRI, and a history of liver conditions. Some implications for use of other pharmacologic therapies is that kratom seems to have a synergistic analgesic effect with NSAIDs, similar to opioid pain medication. Some interactions that kratom seems to have are with MAOIs, SSRIs, and drugs that use the cytochrome P450 pathway. Some important points to ponder for vitamin C. Vitamin C is ascorbic acid and is an essential vitamin for overall health. The mechanism of action of vitamin C is that it's essential in the role of collagen formation. It's an antioxidant and modulates serum levels of cytokines. Some of the indications for use are inflammation and rheumatoid arthritis. The advantages are that it's safe and easily accessible. Some disadvantages and risks are the side effects it produces, such as a redness and warm feeling of the skin, or flushing, headache, nausea, vomiting or diarrhea, upset stomach during or after eating, and feeling faint. Some contraindications exist for those with high oxalic acid in their urine and those with sickle cell anemia. Some implications for other use with other pharmacologic therapies are that vitamin C supplementation seems to show a lower required opioid dose for desired analgesia. Some interactions that vitamin C has with other drugs are aluminum, some chemotherapy drugs, estrogen, protease inhibitors, statins, niacin, and warfarin. For those of you nurses watching this video, we've decided to include an NCLEX question so that you can brush up on your skills before you begin your testing. A patient presents to the emergency department and the charge nurse labels the patient as a frequent flyer when assigning you as the caregiver. The patient has a history of chronic knee pain, anxiety, and limited mobility. When caring for this patient, what is important as the caregiver? Select all that apply. We recommend pausing the video at this moment to allow the classes extra time when answering the question. The correct answers are as follows. Remain non-judgmental as you assess the client. Be aware of your facial expressions, and allow time for the patient to freely express themselves. Thank you for watching our informational video on chronic pain and its role in the community.